So for chest tube insertions, when we have an order for chest tube, we're going to need a couple of things. First of all, we're going to need our procedure cart. We're going to need our chest tube tray, which is going to include our bottle in it. We're going to need dressing supplies, and we're going to need non-trocar chest tubes, which are going to be on the side of our procedure cart. Indications for a chest tube insertion are going to be a hemothorax, which is going to be blood in the pleural space, a pneumothorax, which is going to be air in the pleural space, or a hemopneumothorax, which is going to be a combination of air and or blood in the pleural space. For a chest tube insertion, we'll want to explain the procedure to the patient if possible. We will have the permit signed by the patient prior to analgesic medication unless it's an emergent placement. The doctor will come in and prep the site accordingly. Another thing we'll do is add water to the chest tube bottle for the water seal. So this is the atrium for our chest tube drainage. It already comes attached with the tubing that will attach to the chest tube itself. It's important to remember to keep this clean and dry, as this is what is attached to the chest tube itself. In order to put water in the seal, the water will be attached to the back whenever you open the water seal chamber. You'll put it in the top. You'll squeeze the water in. And this is what will add the water to the atrium system. Once the chest tube is inserted, it will be secured by sutures by the physician. Vaseline gauze will be put in place as well as adhesive dressing over top of it. The chest tube will be clamped until it is attached to the water seal chamber. The end of the tubing can be taken off, inserted into the end of the chest tube. The clamp can be released, and the connection point of the chest tube and the water seal chamber needs to be secured with tape in addition to suction applied to the chamber per doctor orders. When we attach suction to the atrium, the suction tubing will be attached at the top of the atrium and set at a continuous rate between 80 and 120. The dial on the side here will be ordered by the physician, and so you can set that rate according to physician orders by turning the dial on the side. Whenever a patient needs to be transported, the continuous suction can be turned off. In addition to this, please remember to keep the suction below the level of the chest tube. Upon completion of a chest tube insertion, there are a few housekeeping items to remember. First of all, obtain a chest x-ray post-insertion. Documentation in the EMR includes chest tube size, amount of suction if applied, color and consistency of drainage, type of dressing applied, amount of drainage at the end of each shift, document if air leak is present. Provide pain medication as ordered by physician, monitor drainage from chest tube, ensure there are no dependent loops in chest tube drainage tube from patient to bottle, monitor for air leaks. Items to keep at bedside include 2 rubber-tipped hemostats, Vaseline gauze, and a roll of tape available in the event of tube becoming accidentally disconnected.